Well, good morning. I'm Dr. Don Wright, one of the Deputy Assistant Secretaries for Health and Director of the Office of Disease Prevention and Health Promotion. Let me start by welcoming all of you here today. It's a pleasure to have you here with us today for the National Youth Sports Strategy Listening Session. My first task at hand is to introduce Admiral Brett Giroir, the Assistant Secretary for Health here at the U.S. Department of Health and Human Services. In that role, Dr. Giroir is the principal advisor to the Secretary on issues of public health and science, and in addition to that, he oversees many of the public health offices here at HHS, including the Office of Disease Prevention and Health Promotion, the offices focusing on women's health, minority health, vaccine policy, and infectious disease. In addition to that, he oversees 3 presidential and 11 secretarial advisory committees, as well as the Office of the Surgeon General. Admiral Giroir also leads HHS's effort to address the opioid crisis, as well as to eliminate the HIV epidemic. Previously, Dr. Giroir, prior to taking this position, served in numerous leadership roles, both in academia as well as in the federal space. Most notably, he was the first physician to be appointed as an office director at the Defense Advanced Research Project Agency, better known as DARPA. Dr. Giroir has authored or co-authored almost 100 peer-reviewed scientific publications and holds patents on a number of biomedical interventions. He's the recipient of numerous honors and awards, including the U.S. Secretary of Defense Medal for Outstanding Public Service, the American Heart Association's President Lyndon Baines Johnson Research Award, and the Society of Critical Care Medicine's Annual Scientific Award. As a pediatric critical care physician, Dr. Giroir cared for critically ill children for 14 years, and he continues to bring that hands-on, bedside, patient-centered perspective to his work as Assistant Secretary for Health. So please join me in welcoming Dr. Giroir.
Well, thank you, Dr. Wright. I hope if I walk up to the stage a little bit earlier, they'll cut the introduction shorter, but I'm going to have to find some other clue to do this. So thank you all for being here. I think this is a really, really important day. It's important for us to have a listening session as you provide input to the National Youth Sports Strategy. I want to thank Dr. Wright and his staff, Holly Richmond and Shannon Feaster, and all the people from the President's Council, and all the people who volunteered your time. As we were saying in the very, very hot green room, we're going to rename that the steam room instead of the green room, I think. You have probably the best day in D.C. that we've had in 9 months, and you're going to be indoors most of the day. So sorry about that. Surgeon General just came in. How fantastic. Good morning, Vice Admiral Adams. How are you doing? Before I go through some of the prepared remarks, I know both the Surgeon General and I feel very passionate about this endeavor. We can talk about it as with all the health effects and all the long-term effects for the country, but I was profoundly affected by being able to play youth sports and to participate and be on teams, and my life just went from season to season to season, and it was just a great experience for me, and it's really heartbreaking to understand that so many youth, particularly youth in underserved areas, particularly girls, do not have the opportunity to play youth sports or even to be active. And the trend is going in the wrong direction. And I think this is the time that we just, you know, as they say, put the stake in the sand and say, enough is enough, we're going to reverse this trend. It will yield enormous benefits for all of us in the future, particularly for our youth, who will not only learn patterns of physical fitness, but will also gain those kinds of emotional and mental kind of positive experiences that lead to positive self-esteem, to understanding how to play as a team. You know, maybe more people in Washington should have played team sports. We'd do a little bit better on the stage as we learn to play as a team across. Vice Admiral Adams laughing because we know we always go off script and get in trouble, but he's usually worse than I am, so I feel better about it today. So as the Assistant Secretary for Health, my office leads the development of guidelines, programs, and policies to lead America to healthier lives. In November 2018, much to the work of Dr. Wright and his team, Commander Piercy, who really carried the heavy lift, we released the second edition of the Physical Activity Guidelines for Americans, which provides evidence-based recommendations for youth ages 3 to 17 and for adults to safely achieve the physical activity levels they need to stay healthy. According to the guidelines, youth 6 to 17 can achieve substantial health benefits from at least 60 minutes per day of moderate to vigorous activity. Most activity should be aerobic, like walking, running, or anything that makes their hearts beat faster. Youth also need, however, muscle strengthening activity like playing on playground equipment, playing basketball, jumping rope. This new edition of the guidelines also provides guidelines for preschool children. This is the first time for ages 3 to 5. Children this age should be active throughout the day, and adults caring for them should encourage play. And this is probably about 3 hours of active play per day. This is very consistent with the guidelines from Canada, the UK, and Australia. So putting the public health hat on, we spend $117 billion per year, $117 billion per year, and have 10% of all premature mortality just due to failure to meet levels of physical activity guidelines. That's independent of other things, whether you reduce weight or you control your diabetes. Just meeting the physical activity guidelines for adults, which is 150 minutes of moderate activity per week with 2 episodes of physical muscle strengthening activity. If you do that, 10% of all premature mortality in the United States goes away. So when you start calculating this, if 25% more people actually achieve the guidelines, we would save 70,000 lives per year just by 150 minutes of moderate aerobic activity. And what is so great about these guidelines, it's not great about the guidelines, it's great about the science, is that every activity counts. We know for adults, right? So you don't have to do 10-minute bouts or 30-minute bouts. If you walk up the stairs, which is a little bit hotter when you're wearing double-breasted wool uniforms, but if you walk up the 7 flights of stairs, you get credit for that. So this is really achievable by most Americans. And if we want to appreciably affect the health of our country and the healthcare costs of our country, simple things just by meeting the guidelines are so important. But we know that only 26% of men and 19% of women actually meet the guidelines today. So what can we do here? We know that healthy habits start in childhood, and adult physical activity levels are very similar to those seen in adolescence. Right now, only about 20% of adolescents report sufficient activity to meet the guidelines. We know that physical activity fosters normal growth and development. For youth, physical activity can help improve cognition, bone health, fitness, heart health, can also reduce the risk of depression. Further, efforts to increase the activity level of youth are critical as childhood obesity rates have more than tripled since the 1970s. The data that I show in my more formal presentations were a publication that was published by pediatricians in the New England Journal in 2017. It projects that unless changes occur, today's 2-year-olds, by the time they're 35, 65% will be clinically obese. 65% of today's 2-year-olds will be clinically obese. Just think of what that's going to mean to the health of our country and to the health expenditures that we'll have to do. The prepared remarks say children don't usually develop chronic diseases such as heart disease, hypertension, diabetes, but they certainly set them up to have those diseases as adults. I'm a pediatrician. I'm a pediatric critical care physician. I ran a pediatric health system in Dallas. Let me tell you, we're seeing those diseases in adolescents every single day. Type 2 diabetes in my adolescence is growing at an astronomical rate, and in some clinics, the type 2 diabetics are equivalent to the type 1 diabetics that you see in endocrinology. Hypertension, very, very common. And we don't even talk about things like fatty liver disease, which is going to be the leading cause of the end-stage liver disease very shortly and within our lifetime. So these are all things that we really have on our minds and understand that a youth sports strategy can mitigate, if not completely prevent. Many sports can be tailored to various ages and abilities, and you know this, allowing sports participation to continue throughout life at various levels of competition. People working with youth sports programs can teach safe physical activity and serve as role models to support the development of healthy habits, as well as how to maintain those habits into adulthood. This morning, we will hear, and unfortunately I will not be able to stay for most of this, but I will read the transcripts and really understand it. The State of Youth Sports by Dr. Daniel Gould of the Institute for the Study of Youth Sports at Michigan State. Dr. Gould, where are you? Okay. And Dr. Maureen Weiss, there you are, from the University of Minnesota, representing the National Academy of Kinesiology. As I said earlier, there is a decline in sports participation as youth enter middle and high school, and there are particular barriers, including costs, that limit participation in youth sports, especially by minorities, girls, and those of lower socioeconomic status. I'm sure you have the statistics today, but I was pretty shocked when I heard the rough number, and you can correct me if I'm wrong, but the average cost across the country for one child to participate in one sport for one season is about $400. How many people can really afford that? Am I close to the right number? Yes, good. You're shaking your head. If it's the wrong number, they'll correct me after I leave. So, you know, that's the way it goes. So in response to this significant decline in youth sports, President Trump issued an executive order. And if you're not in Washington, I just want you to know that it's a big deal when the president issues an executive order. That means everybody stands up at attention and goes to get to work very quickly. So this is actually a big punctuation mark for the history of youth sports in our country. And that executive order was for my office, the Office of the Assistant Secretary for Health, to develop a national strategy to expand youth participation in youth sports, encourage regular physical activity, including active play, and promote good nutrition for all Americans. Within my office, I've charged the Office of Disease Prevention and Health Promotion, ODPHP, with leading the development of this strategy together and in full collaboration with the President's Council on Sports, Fitness, and Nutrition, and a federal steering committee with experts from HHS, NIH, and CDC. The steering committee planned today's session, and many of them are here with us today, eager to learn from your presentations. And if you've not been involved with these sorts of sessions before, I want to assure you, I want to assure all the panelists and everyone here that this is not, you know, check the box, we need to do this and go on and do our merry way. We really listen to what you have to say. Your advice is really incorporated into our plans in a very meaningful way. Every word, every recommendation is looked over by the staff. They're incorporated in a way that we can, and if they can't be incorporated, there's usually a very good reason why they can't be done at this moment and should be done in the future. So, and one of the reasons I am here as the ASH is to let you know that your being here really does matter, and we really do listen, and this is a very, very important moment. Your work will help inform the National Youth Strategy, which we intend to serve as the roadmap to guide federal efforts to ensure that all youth are able to enjoy the many lifelong benefits from sports participation, including improved health from physical activity, as well as self-esteem, confidence, teamwork, and collaboration. So again, I really want to thank everyone for joining us here today. I can't wait to hear the results of this. I can say of all the efforts we have going on, as you heard, I'm leading the opioids effort in HHS, also the new Ending HIV strategy. These are all very important things. But I know over the long term, if we can get youth participating in sports and getting their physical activity right and their nutrition right, it's going to have more health effects than anything we can do in the short term. This is really the key to the public health of the United States. It's a key to our future. It's a key to our health economy. It's a key to our productivity. It's actually a key to our national security. The last thing I'll say about that is 1/3 of youth 17 to 24-year-old do not qualify for the military because of their physical fitness level. And overall, almost 3/4, it's 71%, do not qualify because of drug addiction, because of obesity or lack of physical fitness, or because of educational statuses. So this is a matter across the board that we need to address. I'm saying this is the first step, and I think it's an historic moment. So again, thank you for being here. I look forward to the results of today. Thank you.
Thank you, Admiral Giroir, for your remarks. As Dr. Giroir mentioned, my office, the Office of Disease Prevention and Health Promotion, has been charged with leading the development of the National Youth Sports Strategy and is working with the President's Council on Sports, Fitness, and Nutrition alongside the Center for Disease Control and Prevention and the National Institute of Health. At the Office of Disease Prevention and Health Promotion, better known as ODPHP, we guide the nation towards better health through disease prevention policies and programs, and we work with national partners and stakeholders to set the national disease prevention agenda. Most of you know we recently led the development of the second edition of the Physical Activity Guidelines for Americans, along with the same partners, CDC, NIH, and the President's Council. The process for developing the guidelines begins with the review of the science by an independent external advisory committee. Federal experts use the work of the advisory committee and comments from the public and federal agencies to develop the guidelines, which is then peer-reviewed prior to release. The guidelines provide the foundation for several federal initiatives like the Presidential Youth Fitness Program, CDC surveillance to monitor physical activity trends, NIH research programs and grant proposals to promote physical activity, as well as campaigns like the Move Your Way campaign and the National Institute of Aging's Go for Life campaign, which promotes physical activity. In addition to informing the federal initiatives, public health professionals use the guidelines to develop and implement interventions that align with the national recommendations for physical activity. Healthcare professionals use the guidelines to help patients and clients understand the benefits of physical activity, and perhaps more importantly, how they can incorporate that in their active daily lives. Policymakers use the guidelines to inform policies and initiatives based on the latest science about physical activity and health. Academic instructors, educators, and researchers reference the guidelines when teaching and conducting physical activity-related research. We are also using the guidelines as the foundation for the development of the National Youth Sports Strategy. The guidelines identify sports as a key sector for helping Americans to meet the physical activity recommendations. As with the guidelines, we want to make sure that the National Youth Sports Strategy is based on the current scientific evidence and informed by experts in the field. Unfortunately, the science base for youth sports does not appear to be quite as robust as it is for physical activity in general. However, we've been completing a scoping review of the literature on the relationship between youth sports participation and various health outcomes. And we've looked at the literature as well on what are the barriers to youth sports participation. We've also completed an environmental scan to look for those model programs, specifically those programs targeting populations with historic low sports participation. As with the physical activity guidelines, the strategy will be written by federal experts. The draft strategy will be posted for public comment and be made available for peer review. We'll then finalize the plan and plan to release it in the fall of this year. In a few moments, Lieutenant Commander Katrina Piercy, one of my staff at ODPHP and the lead for this project, will provide an overview of our work to date to develop the strategy. Lieutenant Commander Piercy also led the development of the second edition of the Physical Activity Guidelines. But first, I'd like to invite Holly Richmond, the Executive Director of the President's Council on Sports, Fitness, and Nutrition, and our partner in the effort, to provide additional introductory remarks. Holly?
Thank you, Dr. Wright, for the introduction, and good morning, everyone. I'm excited to be here with all of you today for this important session. As Admiral Giroir mentioned, President Trump did issue an executive order that charged HHS with developing a national youth sports strategy to expand children's participation in youth sports. This strategy will support the healthy physical, mental, and social development of children ages 6 to 17 by increasing access to sports for all American youth, including those from economically distressed areas, as well as girls and children with a disability. Most often, these are populations that are forgotten and left out of the game, and that's a trend that needs to be reversed. To achieve this mission, the President appointed a diverse group of individuals to serve as members of the President's Council on Sports, Fitness, and Nutrition. They have pledged their commitment to lending their collective expertise to this endeavor, providing their initial input during their first annual meeting right here in this building last September, where the entire focus of the meeting was the development of the National Youth Sports Strategy. They stand at the ready to assist us in any way possible to get this new strategy off the ground and into the implementation phase, including retired Air Force Master Sergeant Rob Wilkins, who will be with us later this afternoon and will actually close out the session. And since the release of the President's executive order, the President's Council has been working very diligently to create a framework for our charge and our mission. We have developed a National Youth Sports Initiative, with the strategy being the primary component. In addition to the strategy, there are several other activations that are in alignment with our mission now and will also be necessary when carrying out the implementation phase of the strategy. These other activations include federal investments for sports programs in underserved communities, partnership engagement, and promotional activities. The President's Council will be holding our next annual meeting this September, when we plan to announce and release the National Youth Sports Strategy at that meeting. While this is an ambitious timeline, we're very aware of that, we're confident that with the assistance of everyone here today, we can make it happen. So I want to welcome all of our esteemed speakers that have joined us for the public listening session. We're very happy to have you all here with us today to inform the development of the National Youth Sports Strategy. And I know that all of you have extremely busy schedules, and I want to thank you for taking the time to come here and to share your expertise with us. Each of you brings a unique perspective to the conversation, and we look forward to hearing and learning from your research and experiences. So now it's time to dive in and get to work. I'll go ahead and introduce our next speaker, Lieutenant Commander Katrina Piercy, the project lead for ODPHP, and she'll be discussing the current status of the strategy and next steps.
Good morning. So I'm going to dive in a little bit and give you all some background on this project itself, where we are and where we're going, to kind of help set the stage for today's discussion. Again, to echo what everyone else has said, I just want to thank all of our panelists for being a part of this meeting, as well as everyone that's here with us today and everyone watching. So to set this up, we've mentioned a few times an executive order that was the impetus for starting this project. So I pulled out some of the text here just to highlight the pieces that we're going to be focusing on. So this was an executive order from the President directing the Secretary and the Department of Health and Human Services to develop a National Youth Sports Strategy report. And with the focus here on children in communities with below average sport participation and communities with limited access to athletic facilities or recreational areas. So we're really thinking, when we're talking about this report, about underserved populations and areas where they don't have access to youth sports and opportunities where we can lift this up. You'll hear from a number of panelists today who have success stories, who have been able to do this in different communities and target different populations, and that's really our focus. We know sports is a big business in the United States, and there's a lot of wonderful programs that are leading kids to college and pro levels, but really our focus is thinking about how can we help kids have opportunities to do youth sports and opportunities, therefore, to meet the guidelines. We've mentioned this already a few times, but just an overview, we're leading this project the same way we did things with the physical activity guidelines for Americans. We realize that a lot of the work in youth sports is not happening on the government level, but where we touch the physical activity space is really 4 key offices, that being ours in the Office of Disease Prevention and Health Promotion, the President's Council on Sport, Fitness, and Nutrition, the Centers for Disease Control and Prevention, and the National Institutes of Health. So our group has formed an executive committee, which is overseeing this project. Then we have a larger federal steering committee that has representation across HHS from the regions, from Office of Minority Health, Office of Women's Health, and other areas that are helping to provide input in this project. And again, as we've mentioned, we have a relatively quick timeline on this, looking to release this September. So I want to walk you through some of the key pillars of this project and the key areas that we're going to focus on. First, to increase awareness of the benefits of the participation in youth sports, as well as the importance of physical activity and good nutrition. Second, to promote public and private sector strategies to increase participation in youth sports. And this is where a lot of you all come in. This is, if you notice the verb, promote. So we're looking to other organizations and groups that have already done this work, that have identified what works, and we'll be looking to point to you all and to your success stories to lift that up. We're not trying to make up new strategies or to reinvent the wheel here. So again, why today's session is really important. Third, to develop metrics that gauge youth sport participation and physical activity. A lot of this work is already being done by CDC, and I'll mention in a few slides some of the data that we do have on the federal side, some of the data we're aware of outside of the federal government. And finally, to establish a local and national strategy that will recruit volunteers and coaching around youth sports, because we know coaching is a big, big piece of this. Now, these are the four main pillars that are going to kind of set the stage for our report. It doesn't mean this is all that we're going to cover, but this is kind of our guiding piece. As you see here, something missing that jumped out at us when we looked is barriers. It's not up here. But of course, we're going to talk about the barriers to youth sport participation and how some of the programs that you all are doing, what are the strategies that can get around these barriers or facilitate that. So let me walk you through a little bit of the development process. We've alluded to a few times that we've got a quick turnaround, but just so you understand how we're going to actually take the information you're giving us today, as well as information we've gathered in the last few months. So we're starting here at the top. We started gathering information. Actually, President's Council started this work last year to get a landscape of what was going on in the Department of Health and Human Services. So a data call went out asking everyone across the department to put in information and work that they were doing related to youth sports and also more broadly around physical activity. Again, giving a sense of what we're doing. We are well aware that the United States does not have a huge focus on youth sports right now. But we wanted to know where we're starting from and then also be able to point to what else is going on in other countries. That is a piece of this as well. Next, and Don Wright alluded to this, that we did a literature review and an environmental scan, realizing the literature is a bit different than the literature we looked at for the physical activity guidelines, where most of those findings are in the academic literature of this amount of physical activity, these health outcomes. Again, why we've gathered you all here today, why we've asked for public comment, is we realize a lot of the information on youth sports is not necessarily in the published literature the same way. A lot of it you all have in your programs, and you've taken those lessons learned and changed your programs or expanded your programs. So we're looking to pull information from that, but wanted to see, what is out there. So we started with those pieces, again, to give us a foundation. We then put out a call for public comments. So this was out for the month of March. We were asking people to provide public comment around these four pillars. We got well over 100 public comments. I want to thank you all for giving those to us. We will read and review each of those and see how they best fit into the strategy. And again, appreciate your time and thoughtful consideration of the pillars. Then we're here today, the listening session. So another way to gather information and hear from you all. Again, we know that a lot of this work is happening on the ground level, and we want to hear from you and what's working in your program. We will then take all this information and actually draft the report. We will put that back out for public comment. That's looking like early summer, and we'll be asking you all to provide comments on that report. Did we miss anything? Is there something that we may have overlooked? We will be asking for your feedback in that. We're also going to do a peer review process similar to what we've done with the physical activity guidelines. We'll identify a group of academic experts and ask them to provide some thoughtful review and feedback on the draft strategy. And then finally, as we do with all federal products, and this will be a HHS report that comes out, it will go through clearance across HHS, and this basically ensures that we're all on the same page from the HHS perspective, and that this comes out with the consistency across CDC, NIH, ODPHP, President's Council. So that's kind of our big picture of how we're putting all of this together, obviously today being really a key part of this. So I want to touch on just a little bit. One of the first pillars talked about increasing awareness of the benefits of youth sports, and also talked about good nutrition and physical activity. And the way we've chosen to address those two pieces, the physical activity and the nutrition, is to point to other federal policy that we already have. As we mentioned already, the second edition of the Physical Activity Guidelines was just released this past November. This is about a 4-year project with an extensive review of the literature, a lot of time and a lot of individuals looking at the science base about how much physical activity we need for health benefits. So we already know that piece. And along with the guidelines was released the Move Your Way communications campaign. As you can see this icon here, this is depicting the amount of physical activity that youth need, which is the 60 minutes or more a day of moderate intensity physical activity, including 3 days of bone strengthening, vigorous, and muscle strengthening activity for kids as well. So we're going to point to those pieces, and same thing we're going to do with dietary guidelines. We're going to point to that from the nutrition piece. So we have the 2015-2020 dietary guidelines for Americans, also the MyPlate, which is a great communication tool to talk about what a healthy eating pattern looks like. As you may be aware, the next round of the dietary guidelines just kicked off last week, the first meeting of the 2020 Dietary Guidelines Advisory Committee. Their work will happen over the next couple years, so we will not be pulling in their work, but will the most current edition of the dietary guidelines. So we're going to be looking to those two pieces to get the physical activity and the nutrition piece, which will allow us to focus more on the youth sports piece for this report. I want to highlight just a few quick pieces here about the data side, because that is a piece that we are already engaged in on the federal side, but it doesn't come with some challenges. And I know we've asked Dan and Maureen to mention this a little bit in their opening remarks as well, but just wanted to highlight to set the stage and why we don't have a data point starting with this, other than we say, you know, that kids right now, we know that the numbers are declining and that there's a lot more kids that could be doing youth sports. Some of the challenges with collecting that information comes from who is collecting it, whether it's self-report or a parent proxy. So who's answering that questionnaire? How are sports defined? And also what sports are in that definition? And so if you are answering a survey, is there a drop-down list of sports that you select from? Do you write it in? There's some variation on how we're collecting that information, which then makes it more challenging to really get an accurate picture of it. The frequency of collection, so how often we're collecting that, when that survey is going out, the time of year. Right now, we're not collecting information about the amount of time spent in sports. And we know there's a variability in the type of activity in terms of how many minutes of physical activity someone is getting doing that sport. And it varies by practice, or by game, or by season. So there is some changes there. And then also the frequency of sports participation. So figuring out, you know, do they play sports and we check the box for one, but they may be playing on multiple sports teams. So how is that information getting collected? So some of the challenges we're kind of aware of and thinking about. And then finally, the linkage between doing sports and meeting the physical activity guidelines. So we know the amount of activity that kids need. And we know sports are great means that youth can meet the guidelines. But we don't necessarily have the connection of if kids are doing this sport, then they're more likely to meet the guidelines, or it gets to X percentage of meeting the guidelines. But we do know that that is a possibility. We just don't have all of those data pieces. And just wanted to highlight this slide is what we've looked at so far in terms of the data piece. And I mainly put this up here for the second column for you all here in the room and also watching this to make sure we haven't missed anything. So we've got a long list of different data pieces that we've got on the federal side. A lot of this is managed by CDC. And then we've got a list of non-federal surveys. I know a lot of organizations use the SFIA one. A lot of that information is proprietary. And so just thinking about how we're collecting this information, how we're disseminating it, again, is there gaps or things that we could be doing from the federal side? So I'm going to dive in before I hand things off to our first speakers to just give you a little bit of an overview of today's agenda. It is really packed. When we put out a call for individuals to speak at today's meeting, we got a tremendous response. It took us a lot of time to go through and decide how this would fit. We ended up organizing individuals into panels to help group things by theme. We realized that a lot of programs actually cover more than one area. So we've asked people to kind of focus in on, you know, where they might have something unique or different around, you know, coaching or around different programming. Following each panel, we're going to have some moderated Q&A. And so that'll be for us on the federal side to ask some questions and get some clarification about this project, but also for you all in the audience to ask some questions and the other panelists to ask questions and to think about this. So we want this to be a collaborative piece. We've asked Dr. Maureen Weiss and Dr. Dan Gould to start us off today to help provide the lay of the land and an overview. So that way everybody doesn't have to get up in your 15 minutes and tell us where we are in youth sports. They're going to do it for us. So that'll help kind of really set the stage. So we're all kind of starting from the same point and aware of kind of some of the challenges, some of the opportunities, and then what are some of the gaps that we could be thinking about on the federal side as we're writing this report. What could we be doing? Where are spaces that we could help or do more in this space? So we'll talk first with the current state of things, National conveners and advocates are our next panel set. We'll have a lunch break after that. Non-traditional programming is our next panel. And then the last two will talk more about coaching strategies, recruitment training, things like that. And then look at programming from a variety of different levels. So looking at national, local, and the state level, some success stories from that. Again, we'll have some Q&A for each of the panels. We'll have them up on stage in between to talk more through things. This is just some details, and Celeste, who's moderating things, will put this up again. When we do get to Q&A, we just ask, we are video recording this meeting and taking notes. We do want to make sure we know where the questions come from. So please state your name and tell us your organization so we can make sure we capture that information, and ask that you just be concise and ask questions relevant to that panel. If you didn't get a chance to ask a question, or for those that are watching this via webcast, we won't be able to take your questions live, but you can send them in to us via email. We'll take them through this evening at midnight. And then finally, just to wrap up some of the next steps. So where are we going from here? We're going to take all of this input today, as well as all the public comments, the lit review, the environmental scan, all of these pieces together, and work on finalizing a draft of the report. We'll put that out early this summer and ask for public comment on it. For you all, we ask how you can be involved. You can follow the listservs that we send out from ODPHP, that's through health.gov, or the President's Council listserv. We will be sending messages through those, as well as on our Twitter handles. We ask that you will review our draft report, provide input, and then when we do release in September, again, we'll announce all of this through our listservs. We welcome you to be a part of that release and help us lift up and disseminate messages from that. So finally, just wanted to thank you all for being a part of this meeting and for all of the information you're going to share. I'm looking forward to learning a lot today, and just to really appreciate your time. I'll hand things next to Dan and Maureen to get us started today.
Produced by the U.S. Department of Health and Human Services at taxpayer expense.